Hello and welcome, everybody. Hope you're all having a fabulous Friday if you're here in the Friday time zone, and Saturday if you're in the Saturday time zone in the future. You are tuning in to Ask Doc Live. So happy to have you all here. It is just so encouraging to see more and more people that are seeking information that empowers them to be able to take their own health into their own hands, because there's so many different options out there that are not working. I'm just going to leave it at that. And I was seeking them also and finally found the one that does work, and there's no way I'm going back. No way. So you are tuned into Ask Doc Live. My name is Rebecca Dukes Kozak, and I will be your host for the next 2 hours. I am joined with my co-hosts, Ruth Ellen Sanchez, Dr. Judy Reynolds, Heather Bowen, and Nasima Omar. And we are here to help you get that information that you need in order to make your health journey the story you want it to be. Now, if you are on with us live, make sure that you have that chat box open or that chat option open so that you can see all of the valuable information that our co-hosts are adding into the chat, so that you can take a screenshot and capture that information so that you can refer back to it later. The information is going to go by fast. We like to get as much information in as possible and not have to go back and repeat something. So if you are on watching with us, or even if you're watching the replay, AskDocLive.com has all of our replays that we have been airing for the last 2 years, Doc. It's been just over 2 years. I am so excited that we are able to bring this information to everybody. But those replays, I love the fact that you can start it, stop it, write down what you need to, and share it with a friend. So that's one of the major purposes that we have put this, or the major reasons rather, that we put this program together. It's to be a resource that can be shared. If somebody shared this video, shared this link with you, make sure that you get back with them and thank them for sharing and taking the time to think about you, so that you also can choose a thriving health journey instead of barely surviving. Now, I love this program. I love the fact that we're bringing information to you. The information that is shared today is for educational information only. And folks, our food supplies around the world, not just in the United States, but around the world, are empty and void of the nutrition that our body really, really needs, especially those minerals. And the information that is shared today is going to help you find the best resource for those minerals. Now, Dr. Wallach doesn't like to call them supplements because they're not supplementing a diet. They're the essential things that our body needs in order to thrive. The Food and Drug Administration does require us to let you know that the statements have not been evaluated by the Food and Drug Administration. The products discussed are not intended to diagnose, treat, cure, or prevent any disease, and the information contained on this Zoom is for informational purposes only. If you are pregnant, nursing, or taking medications, please consult your healthcare professional before taking any supplement program. Now, so many people have been diagnosed with something that is quote unquote genetic. I know I was, but through the science of epigenetics, that genetic theory has been proven incorrect. So we have more control over the way that our body, our genes express themselves early and late in life. And to guide us through that is one of the founding fathers of that science of epigenetics. He has received so many accolades and acknowledgments for all of the research that he has done over the decades that it just honors me to be able to share him with you on this program. Dr. Joel Wallach, welcome to Ask Doc Live.
Thank you so much, Rebecca, and to your whole team. Of course, always. I can't thank you enough for all the kind words and the sort of the explanation of what's going on here. And of course, the science that has replaced genetics is called epigenetics. You know, my thesis for my 20,000 autopsies is a $25 million grant from NIH. It was at Washington. There you go, Washington University and Barnes Hospital in St. Louis. It was a 10-year project, and I showed that there were no genetically transmitted diseases, and there's no autoimmune diseases. They're actually just nutritional deficiencies. And this has been like crazy, okay? And as you said, I have found and was able to eliminate the cause of birth defects. There's no genetic birth defects. Cystic fibrosis was the first one I discovered in a primate at the Yerkes Primate Center, Emory University in Atlanta, Georgia. I was working for NASA. And it's very clear that this information that they were giving out was not true. Well, this book, Epigenetics, only costs $25 for 300 pages. It's a summary of my thesis, which sells, the thesis sells for $25,000 each. Okay. It's called The Disease of Exotic Animals. It's in the Smithsonian Institute of National Treasure. Nobody was going to spend $25,000 to get a recipe book for healthy living. So we came out with a summary of it called Epigenetics, the Death of the Genetic Disease Transmission. And that's available for $25, and it sells like crazy because it's a $25,000 piece of information for $25. So why not do it? And one of the things we found out, of the many things we found out, was that again, things that were said were just not true. Things were just made up. We found the cause, prevention, and cure of cystic fibrosis. We found the cause, prevention, and cure of muscular dystrophy. We gave it to Jerry Lewis. He took it to the Muscular Dystrophy Association, and you have to appreciate he had worked for them for 50 years with a telethon. He had raised 2.7 billion with a B, $billion over 50 years. And they fired Jerry Lewis when he brought them the information showing this muscular dystrophy was not a genetic birth defect. That muscular dystrophy was just a simple nutritional deficiency. And we went with my attorney, Jonathan Emord. Oh gosh, I don't know how many years. It was like 15, 20 years we spent in federal courts petitioning and suing and petitioning and suing. We finally got these nutrients to be put in the baby formulas, and we eliminated sudden death syndrome. Now, sudden death syndrome was supposed to be caused, according to doctors, over a 25, 30-year period. They said that sudden death syndrome was caused by mothers sleeping on the babies and suffocating them to death. Well, as soon as we got these nutrients put into the baby formula, sudden death syndrome disappeared. Oh, it was just a simple nutritional deficiency disease. 1990, the rate of sudden death syndrome was, let's see here, per 100,000 normal births was 135 to 140 SIDS deaths. Well, today is 15 to 20 per 100,000 normal births. So we've reduced the rate of sudden death syndrome by 95% just by simply putting those nutrients in the baby formulas. Now, there's people who don't use the baby formulas, they don't get access to those nutrients. That's why their babies die. Okay, it's called hypertrophic cardiomyopathy heart disease. It's a deficiency of a single nutrient. And of all things, we learned about that disease in turkeys. Okay, and so that's how we came across that. Now, one of the things we did find out, these young athletes that die every year in America, 500 to 1,000 every year. Okay, they die suddenly. They're 20 years old, 18 years old, 12 years old, 25 years old. And they said, we don't know why, they just die. They don't have any drugs in them, they just die. Well, that's because they're missing those nutrients. Okay, the same thing as in SIDS, sudden death syndrome. And so he came up with a sports drink for them called Rebound. It has 100 nutrients in it. Things like Red Bull is an energy drink. Red Bull has, a lot of sugar and caffeine in it. Our Rebound has 100 nutrients in it, 75 minerals and 25 vitamins, amino acids. And we have 30 sticks in a box of that. Mix it with your water. We have the canister. It has 36 doses in there, 36 doses. And we have the cans back again. Now, the cans do have carbonation in there. And so what I do when I drink a can, I'll pop it open, say 15 minutes before breakfast. I'll put it in the refrigerator, and I'll drink it for lunch 3 hours later because it's off gas the carbonation. I don't want the carbonation because it neutralizes your stomach acid. So, but I do go through at least 1 or 2 servings of the Rebound every day. Okay, because I do a lot of sweating. I do a lot of work. Okay. Now, with all that said, remember, there are no genetically transmitted diseases, and you can prevent all birth defects by making sure that the mother is getting all the 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, for at least a minimum of 6 months, better yet, a year or so before pregnancy. And then just have her keep taking those things throughout the pregnancy, and there won't be any birth defects. It's just that simple. Okay. Let's start out. Well, what is the U.S. population? We're going to talk about arthritis first, which is a very common disease. Ho-hum disease, arthritis. U.S. population is 332,228,200. Okay. Right now, we have 58.5 million cases of arthritis in the United States. That's 24% of the American population. Okay. And juvenile arthritis under the age of 16, the world has 3 million, and we have 300,000 juvenile arthritics underneath 16 years of age. And again, it's just the same nutritional deficiencies. Okay. And so this is why we have these problems. It's not a genetic thing. It's not an autoimmune thing. So this is not difficult. We do have, again, if finances are an issue, I like the Healthy Start Pack. It has the 90 essential nutrients in it. And you can throw in there the glucogel, which is collagen from beef, and we call it the Healthy Bone and Joint Pack. That's what we did for Theo Ratliff, a great basketball player many years ago. He, let's see here, was 24 years old, and he had bone-to-bone arthritis in his knees. He popped a cartilage off his right hip. He got a fracture of his right wrist, which was a shooting arm, and the Atlanta Hawks took his contract away from him. He was playing basketball. Of course, he's like 7 foot tall and plays basketball. And so he came up with the Healthy Bone and Joint Pack for him because we put the glucogel in there to give him the collagen in addition to the 90 essential nutrients. And, after a year's time playing with other universities and things, some professional teams, he got a contract for $35 million for 3 years. And then he played for another 11 years, made another $100 million because he was taking these 90 essential nutrients, maintaining his bones and his joints and everything. Okay. And of course, I have to give him a lot of compliments because he took a substantial amount of his earnings, his contracts, and made all kinds of facilities in Georgia and Alabama to train young athletes how to perform safely and so forth. And I'm just very proud of him for that. Okay. The annual cost of treating arthritis by medical doctors in the United States is $626.8 billion with a B. Annual cost of treating arthritis, not preventing it, not curing it, according to the medical system, because it's a genetic thing. There's nothing you can do but just, relieve the pain, increase the mobility of the joint, and people are happy about that. Well, we spend $626.8 billion with a B, $billion each year just to treat symptoms of arthritis when we can get rid of it in weeks. Okay. The medical system has turned the arthritis community into a dairy herd, and they milk it every day. Okay. Osteoporosis is kind of a sister disease. Osteoporosis is the whole bone. Arthritis, usually people are thinking in terms of joints. Okay. Arthritis. But osteoporosis are the whole bones. And the only thing I could find on the amount of money spent dealing with osteoporosis, and you first have to appreciate in the women's population, 19.6% of women at any one time have osteoporosis, and men 4.4%. Why do women have 4 times more osteoporosis than men? It's not a genetic thing. It's not a gender thing. It's a dietary thing. They give up all the stuff that has nutrients in it because they want to be thin and look beautiful and all that kind of stuff. And so it's a dietary choice on their part. Well, the thing that I found, when you look at the US, Canada, and the European Union, okay, EU, okay, combined each year spend, holy moly, just to treat the symptoms of osteoporosis, not to cure it, not to prevent it, okay, $6.5 trillion, 6.5 trillion, that's $6,500 billion each year just to treat the symptoms of osteoporosis in the US, Canada, and the EU. Holy moly. Okay, now that's the worst one. Okay, arthritis is the worst one. Let's look at diabetes, another costly one that comes in second of all the major diseases. Let's see here, there's 37.3 million cases of type 2 diabetes mellitus in the United States. That's 11.3%, a little more than 10% of the population. The pre-diabetics in the USA are 96 million pre-diabetics in the United States. Okay, it's almost 30% of the population of Americans are pre-diabetic. Okay, it's a simple nutritional deficiencies. There's no genetics involved in diabetes. There's no autoimmune in diabetes. It's a simple nutritional deficiency, okay? The annual cost of treating the symptoms of type 2 diabetes in America each year, not preventing it or curing it, is $342 billion. $342 billion, about half of what we spend for arthritis. Now, why do these things cost so much? Cancer only costs $190 billion a year to treat. Well, cancer, they treat you for 4, 5, 6 months and either you win or lose. But arthritis, they treat you every day for 20, 30, 40, 50, 60, 70 years. Same way with diabetes. They treat you for 20, 30, 40, 50, 60 years every day for diabetes, and they are milking the system. Okay. And so that's why it's $342 billion for diabetes. And, we're looking at other countries and things. And so it's one of those things where some of these countries, like in the Philippines, are coming along. Their population is about a third of ours. Okay. They have 109 million people, 3.7 million cases of diabetes, 100 die every day. And diabetes is the 4th leading cause of death in the Philippines. And by 2030, you're supposed to have 7 million cases of diabetics. Okay. And it's one of those things where, let's see here, they're looking at 1 in 5 are pre-diabetics, 1 in 5, 20% are pre-diabetics. This is crazy when you think about it, because these are all nutritional deficiency diseases. So I urge everybody to think about this. We have the Healthy Bone and Joint Pack. We have the Healthy Blood Sugar Pack. If you have both of those, I'd go for the Healthy Bone and Joint Pack. No, I'd go for the Healthy Brain and Heart Pack, and then add the MSM, add the, let's see here, collagen peptides, add the sweeties for the diabetes, and I would also throw in the collagen, let's see here, from beef also would be the glucogel. Okay, that was our original collagen. And then don't forget the vitamin D3, take 3 of those twice a day per 100 pounds of body weight. And if you have high blood pressure in there, you throw in the Ultimate Daily Classic tablets to support healthy blood pressure and healthy blood flow through blocked arteries. And we already talked about the diabetes. So this is very, very simple stuff. Okay. And so I urge you to pay attention to these details, because we can save Americans and everybody on earth an enormous amount of unnecessary misery. We can add many healthy years to their life, 25 to 50 minimum. And then when you look at the biblical stories, and people live to be 300, 400, 600, 969 for Methuselah, almost 1,000 years. So, even if we only can live 250 years, that's a lot better than 60 or 75. Okay. And so that said, I'm so excited. I'm going to turn this over to Rebecca.
All right, Dr. Wallach, thank you so much. It blows me away, those numbers that are spent on treating a condition. And that's only what's reported through insurance companies. That's probably not even including anything out of pocket. Nothing that's done over the counter is whenever you go to the corner store and you pick something up, they're not asking you, well, why are you taking this type thing? So the numbers just blow me away. And the sugar issues are one of the things that I dealt with, Dr. Wallach. And they even called it something going on with my metabolism, where I had metabolic syndrome.
Oh, the
and
metabolic
something going on
syndrome.
with my insulin that was called insulin resistant. It's like all these different things that they made so complicated. And when I went on your program, it was simple. Yes, I had to be intentional, but it was simple. And now
how
I
long
don't
was
have
it
to
when
move
you started taking these programs, the nutritional programs? How long did it take for you to see significant benefit?
Oh, within 2 weeks.
And how long had you been suffering from the metabolic syndrome?
At least 10 years.
Okay, so 10 years suffering, and in 2 weeks' time taking a nutritional program, your same results.
Yeah. And it was simple. So simple. So I just, from the bottom of my heart, I invite anybody that is dealing with unpleasant health concerns to just give us 90 days. Get back with the person that invited you to watch this program. If you're part of our newsletter and you received an invitation through email, reply back to that email. And let's find out exactly what you need in order to address your specific deficiencies.
Yeah, and Rebecca, here's a question for you.
Yes.
Do you need a doctor's prescription to go to a pharmacy to get test strips to see if you have diabetes?
No, $25 at the corner store. You get a tester, you get strips, you get even a poker to poke your finger. Pretty simple. And I did it for many years, just trying to control those things with diet alone. And the diet alone, Dr. Wallach, was making me sicker and sicker because I had the wrong information.
Well, we'll give good thanks to the Lord and for making sure that you got the right information. And so many people have gotten the information. And we are seeing a national benefit. We're seeing a national benefit. We're seeing a national tide, away from the metabolic syndrome to just simple nutritional deficiencies and easily dealt with. Right.
Well, and that tide, Dr. Wallach, can go both ways depending on what news you're looking at. Because some of the stuff that we're looking at is just getting worse and worse and worse. And from my experience, it does not have to be. I don't care what age you are, whether you're young, whether you're old, whether you're middle-aged like me, and I'm proud of it. Your body does miraculous things. That's just the way it was divinely designed.
Yeah, you can have diabetes for 25, 30, 40, 50 years and, have really a lot of complications and troubles. And you get on our program, and in 6 to 10 weeks, suddenly now you're saying, oh my gosh, I got to redo my test here because this can't be right. It is right, because your body has a capacity to recover when you give it the right stuff and take away the bad stuff.
That's right. That's right. And Dr. Wallach, there's something that she keeps saying, and if you, take this, then your gray hair will start, going away. I took a picture the other day because I was looking in the mirror doing my makeup. I'm like, wait a minute. That big streak that was right there is no longer there. Everything is going back to the color.
Well, how long did you have that streak of white hair? How long did you have that streak of white hair?
Oh, I first noticed it probably 20 years ago.
Okay, so at least 20 years. And then how long did it take for it to start disappearing?
I don't know exactly, because when it was yesterday when I looked in the mirror, when I realized it's not. And recently I've been very intentional and increasing some of the supplements based on your recommendations. And so I'm going to say just, that month of being intentional has really made a difference.
Give us 90 days.
That's right. Well, I'm going to give you more than 90 days, Dr. Wallach. I'm looking at 90 plus years.
All
and
right.
Many others are as well, because they've experienced, even in short amount of time, significant improvements. And whenever you have those little bits of improvement, it just is such an encouragement to keep going.
Well, thank you for the report.
Well, thank you, Dr. Wallach. And we have Brenda who has her hand up. Brenda, go ahead and unmute yourself. I know she doesn't have camera, but go ahead and unmute yourself. You're on live with Dr. Wallach.
Okay, thank you. I am a woman of 67 plus years, around 5'3", used to be 5'5", 150 or so pounds, and been on the 90 for life for many years, and other nutrients. I don't eat bad foods or liquids, and I went to the eye doctor yesterday, and he took advanced x-ray films of my eyes and retinas and said I have scar tissue on the retina and cholesterol buildup behind the retina, and that is why my cataracts are worse. I have been having dry eyes also and using eye drops, and he said at least 3 times a day to keep them moist, and he's prescribing glasses. I have to wear glasses now for a while to see if it corrects the problem. If not, he wants to remove both cataracts in both eyes, one at a time, of course. And then the vision has worsened since a 2008 cervical MRI, and taking Xarelto for a DVT blood clot in the lower left leg since February. I'm down to every other day.
Okay, stop.
Okay.
Okay. Do you have any tinnitus or ringing in the ears?
Yes. Long time ago, for a long time.
Okay. Let's see here. Rebecca, what's she got?
She's got osteoporosis of the skull, Dr. Wallach.
Yeah. And so what's happening, your skull, you have osteoporosis of the skull, squeezing the auditory branch of the 8th cranial nerve. Get that book. It's all in your head. And you'll see that. It'll blow your mind. Doctors, if they know about it and they don't tell you about it, shame on them, right? If they don't know about it and they're just ignorant, shame on them. Okay. And so the skull is squeezing the optic nerve, the optic artery, and the optic vein. Okay. And that's why you have this stuff going on with your optic nerve. And also you got that ringing in the ears, the tinnitus. Do you have any balance problems or vertigo or dizziness?
No, but I do have dislocated and bone loss joints, jaw joints and stuff, because I had a dentist crack them apart at age 25. So I've been dealing with that for years.
TMJ.
Yes.
Okay. TMJ, that's osteoporosis and arthritis of the jaw joint into the skull. It's part of the skull.
And right knee also bone on bone from a horse injury at age 15. So it's pretty bad too.
Yeah. Okay. So here's what we're going to do.
Okay.
This is what I want you to do. 150 pounds, you got to get rid of all the bad foods to maximize absorption. Absolutely no fried foods. And that means no air frying, no deep frying, no pan frying, no processed meats of any kind, no ham, no bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam, because of all the chemicals. And absolutely no oils, no cooking oils, no salad dressings, none of those things, because they oxidize and turn into trans fats and cause all kinds of bad inflammation. And then no gluten, no wheat, no barley, rye, and oats. Do you eat oatmeal for breakfast?
No, I don't eat any of that stuff. I pay attention to you.
Okay, good. No, none of the gluten
grains. I have fruit smoothies in the morning.
Okay, good. But you also need to be, taking the 90 essential nutrients and so forth.
I do.
And so let's see here. You're too young to remember wood stoves. Okay.
Yes.
Okay. And so when we had wood stoves, we had the wood ashes every morning, which were our sources of minerals in our food. And then when we went to electricity, there was no more wood ashes, no more minerals. And doctors said, oh, don't waste your money on vitamins and minerals. Just eat well, you get everything you need. The 4 food groups, the 7 food group pyramid, and shame on them, because they're the ones that created all this problem. Then I also want you to take 2 bottles a month of our MSM. 2 healthy brain and heart packs. Okay, full dose everything twice a day. 2 bottles of MSM, so you can take 3 at breakfast, 3 at lunch, or dinner time. And they will support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, discs, between vertebrae, bone breaks, including the skull. Okay. When you have osteoporosis of the skull, your skull goes from a normal of a quarter of an inch thick to an inch to 2 inches thick. And all those tunnels that 12 pairs of cranial nerves and spinal cord go through are losing the internal diameter of those tubes and tunnels because the skull is getting thicker and thicker. So that's why you need the collagen peptides. Put a scoop of that in your morning drink and a scoop of that in your evening drink. Don't forget the Beyond OsteoFX. Take a scoop of that at breakfast, a scoop of that at dinner time. Also, once you get vitamin D3, 3 of those twice a day. That's 2 bottles a month to help you absorb the minerals and put them in the right places. Last question, do you have any diabetes or high blood pressure?
I'm using Sweetie. It was the last time I had a blood test, the blood sugar was 97. So I started using 2 bottles per month of Sweeties, 1 to 2 bottles. I started 1 and then I added an extra bottle. So,
Okay.
and I don't
Okay,
have
good.
no high blood pressure, but the bad eyes and, other
Yeah, that's
stuff
the
going on.
skull. Yeah, well, that's the skull squeezing the optic nerve, the optic artery, and the optic vein. Okay, and again, this eye doctor doesn't know anything about osteoporosis of the skull. So
No.
what you should do is text him a picture of the cover of that book. It's all in your head.
Yeah, I did let him know, and I gave him a brochure from Zyto.com scam too for based on a scan. Based on longevity supplements, but he sells his own supplements, so
Well,
he's a competitor.
There you go.
Yeah.
There you go. But he can still use the book.
Yep.
Okay.
Okay.
He can still use the book. But at any rate, we want to kind of bring him along here and, take a picture of your hair because the odds are at your age, you have a little bit of gray or white or silver hair, right?
Most of it's brown, my original color, but yes, on the sides and underneath it's gray. So yes, I need more minerals. I know that.
Okay. So what I want you to do, take pictures of the side and the back and front of your hair.
Okay.
And then every month, take another picture.
Oh.
And you'll see the hair color coming back. And you're absorbing the nutrients at that point when your hair color starts coming back.
Okay? I never thought about that. Thank you. Good idea.
Yeah, and so that way you can show your friends and your relatives and your eye doctor and so forth. Say, look, this is unimpeachable evidence here.
Wow. Thank you. I appreciate that.
So we look forward to hearing from you because you're going to have a great story for our team. Okay.
Yep, definitely. Thank you.
Okay. God bless, Brenda.
Thank you. Bye-bye. You too.
All right. Thank you, Brenda. Now, Dr. Wallach, I have an email that has come in, and I get this question a lot from men. They're concerned with prostate health.
Well, it's got to be a male.
Well, yeah, it's usually coming from men. Wives are not often asking for their husbands. Men are stepping up and admitting.
Well, women don't have prostate glands.
Well, no, they don't. I don't. So you never know. But what would you recommend? Well, first, let's go into what are some of the actual causes of prostate concerns.
Okay, how old is this guy? What does he weigh? Do you know?
Let's do in general, because it's a general question that's coming in from Jeff.
Okay.
He doesn't give any additional information other than he also has blood pressure concerns.
Okay, so he's got prostate and high blood pressure. Okay. And we don't know if he gets up 10 times a night to urinate on any of that kind of stuff. Okay. So basically what he's got to do per 100 pounds of body weight is give up all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rhinos, no sugar, no carbonated drinks. Okay. Even the diet ones got to go because even the diet drinks have carbonation in them. And then I want him to have, let's say per 100 pounds of body weight, I want him to have 1 healthy brain and heart pack per month. If he weighs 120 pounds, it'd be half a dose of that healthy brain and heart pack at breakfast, half at dinner time. If he weighs 150 pounds, it'd be 2 healthy brain and heart packs, a full dose of breakfast and dinner, and so on. And then because he has a prostate issue, I would also have him take the MSM, 2 bottles a month. That's so he can take 3 with each meal. And that's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including in the prostate gland. Okay, it has a lot of fibrous connective tissue in it. And then he also needs the collagen peptides, a scoop of that in his morning drink, and a scoop of that in his evening drink. Excuse me, the Beyond OsteoFX, a scoop of that in his morning drink, and a scoop of that in his evening drink. And then for the high blood pressure, oh, wait a minute, still for the prostate gland, he needs the ProstFX. He can take 3 of those twice a day. It's 2 bottles a month. Okay, it has all the nutrients in it necessary for prostate function, prostate health. And then you have to appreciate if he's getting up 2 or 3 or 4 or 5 or 10 times a night to urinate, and the doctor's saying, oh, you have a prostate problem. Well, women have the same problem. And invariably, it occurs because they have something going on, either osteoporosis in the skull, or they have spinal stenosis and have osteoporosis of the skull and the back, sciatica, peripheral neuropathies, which are squeezing the nerves that control the, the bladder, okay, the urinary bladder. And so that's why they get up at night to urinate. But when a doctor hears that, he says, oh, you got a prostate problem, because he gets to do biopsies and, runs the bill up a little bit, okay? High blood pressure, I want him to get 2 bottles a month of the Ultimate Daily Classic tablets, 3 words, Ultimate Daily Classic tablets. Take 3 at breakfast and 3 at dinner time, and they will help support healthy blood pressure and healthy blood flow through blocked arteries. Don't cold turkey off your medication if you're on medication for high blood pressure. But if you're on medication for high blood pressure, as the blood pressure begins to come down, and it will, you can slowly reduce the medication based on the numbers. Usually within 6 to 10 weeks, it's gone. So I always say, give us 90 days, because you're going to see something positive and dramatic, within weeks. Just keep going. Don't stop the program, but you do want to reevaluate everything else. I'd go back to the doctor one more time, say, okay, doctor, give me another examination and see what you think. And he's going to ask you some questions. If he's an honest doctor, he says, what are you doing different? Because you're seeing improvement here. We never see improvement. What are you doing? But they're not going to ask you that, but let's see if he does. Okay, back to you, Rebecca.
So an underlying cause of prostate issues, Dr. Wallach, we're looking at osteoporosis of the skull and hormonal issues. Am I correct? That's
correct. And of course, another thing, as long as they don't have any cancer in the prostate, you can also take the ProstFX, 3 of those twice a day, okay? And they give the Sertoli cells in the testicles raw materials to make testosterone, which makes the prostate gland happy, but you got to make sure the prostate gland doesn't have any cancer in it before you do that.
All right. Thank you so much for that, Dr. Wallach. And just a reminder to everybody that is on live with us, if you would like to ask a question of Dr. Wallach, raise that virtual hand. So if you're like this, I can't see that. I'm seeing Dr. Wallach and myself and whoever is our individual that is sharing their information with Dr. Wallach, so that he can give them what would be the best protocol for them, the best plan in helping them on their health journey. So with Zoom, go to the Zoom menu, click on reactions, and there you will find the raise hand. I have so many questions that come in through email, Dr. Wallach, and the next one is from Robert. So Robert is 67 years old, 290 pounds, and his major concern that he's sharing with us, Dr. Wallach, is lymphedema.
Okay.
He doesn't give a height, but
okay.
what would be something that you would recommend for somebody that has lymphedema at 290
we'll give him
pounds?
We'll give him a little benefit of doubt here and say, give or take a little bit, he's 6 foot tall, so he's 90 pounds overweight. Okay. And then edema, this could be due to obstructed arteries. This could be due to congestive heart failure. This could be caused by emphysema in the lungs. All kinds of stuff can be going on here. You can have kidney issues and high blood pressure. So we're left with a lot of questions. So here's what I'm going to suggest, because this is a big opening here. Okay. So this guy needs to get rid of all the bad foods, no fried foods. That means absolutely no air frying, no deep frying, no pan frying, no processed meats of any kind, absolutely no oils of any kind, no salad dressing, no cooking oils, no gluten, no wheat, no butter, rye, and oats. No wheat, no butter, rye, and oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin, but it's still gluten. And then he needs to get rid of all sugar. All sugar. There's no good sugar. And then none of the carbonated drinks. Even the diet one's got to go because the carbonation neutralizes stomach acid, so you cannot efficiently absorb minerals and digest food. Okay. Then at 290 pounds, I want him to get one keto meal, one keto shake, either strawberry or chocolate per day, except on the weekends. He could pick one day, Saturday or Sunday, and do 2 meals a day, 1 day a week on the weekend. But during the week, when he's got, things to do and got to go to work and stuff to do and so on, just one keto meal. And again, it's a meal replacer. It's not to add to a meal. And he'll lose a half a pound to 2 pounds a day. So realistically, we're looking at 4, 5, 6 months here to get down to 200 pounds, just doing that. Okay. And then I want him to have, ideally, because of his weight, he should be taking 3 healthy brain and heart packs per month. If it's a financial issue, don't take any less than 2 healthy brain and heart packs per month, a minimum of 2 doses a day. But if finances are not an issue, you can take a full dose of breakfast, lunch, and dinner. Then he also needs 2 bottles a month of the MSM, so he can take 3 with breakfast, 3 with lunch, 3 dinner time. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, including the valves in the heart and the tendons and ligaments in the heart that help restrain the valve leaves and so forth. There's a lot of connective tissue in the heart. It's not just all muscle. It's very interesting. And then, let's see here. I would also have him take the de-stress capsules, capital D, like David-stress. That's in case he has congestive heart failure. The de-stress capsules are made for congestive heart failure, and they will help support healthy heart function, healthy kidney function, and so forth. He also should be getting 2 bottles a month, maybe even 3. At his weight, 290, I'd get 3 bottles a month. Again, if finances are not an issue, if finances are an issue, don't go any lower than 2 of the Ultimate Daily Classic tablets. Ideally, he would take 3 at breakfast, 3 at lunch, 3 at dinner time, and they will support healthy blood pressure and healthy blood flow through blocked arteries in the brain, the heart, the kidneys, the lungs, every place else in the body. Okay. And then I would also, let's see here. I would have him use our Rebound again as an energy source. Again, none of the soft drinks. And the Rebound, if he's going to use the cans, he's got to pop the top, put in the ice box in the morning, and don't drink it until noon. Let all the carbonation off gas. If he wants to drink it right away, you can use our sticks. There's 30 sticks in a box of the Rebound. These little guys. And then, of course, the canister has 36 servings in there. Okay, and that has no carbonation in it. So you have your choices, where you're going to get your Rebound. It has 100 nutrients in it, 75 minerals, and 25 vitamins, amino acids. It's the only sports drink that has all that much nutrition. Most sports drinks are primarily caffeine and sugar because they're really just energy drinks. They're not really sports drinks. Okay. So with that said, that's what we're going to do here for Robert. We do need to hear from him on a regular basis because he's going to have a great story.
All right. Thank you so much, Dr. Wallach. And Marie, I see that your hand is up, but I don't see that you have audio connected. So if you could make sure that your audio is connected by clicking on that little microphone and then selecting use device audio or audio through Wi-Fi, that would be fabulous. And then I'll be able to ask you to unmute. All right, as she is doing that, Dr. Wallach, we have another question that has come in regards to diabetes. Blood sugar issues.
Okay, is this Marie or somebody else?
No, this is somebody else. So this individual, she is 115 pounds. She is 5'6", so she's a little underweight, in my opinion. I was 5'7" at 118 in high school, and I see pictures and I was just way too thin. And she also has blood pressure issues, Dr. Wallach. So at 67, no, she's 77. What
She's
would
77.
you recommend for her?
Okay, I missed that. She has other issues other than diabetes?
Blood pressure.
Oh, high blood pressure. Okay, this is not unusual to have that combination of stuff. Okay, again, she needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rhinos, no sugar, and no carbonated drinks. The diet one's got to go. And then I want her to have one healthy brain and heart pack per month. One healthy brain and heart pack per month. I want her to get another bottle of our selenium, so she can take 3 of our selenium with the 5 cofactors at breakfast, 3 at dinner time. That's for her heart and her kidneys and muscles and all that kind of stuff. I also want her to have, again, one healthy brain and heart pack per month, so she could take a dose of breakfast, half a dose of dinner, that extra bottle of selenium. I want her to get the canister of the collagen peptides, so you can take a scoop of that with her breakfast drink, a scoop of that with her evening drink. I want her to get the MSM, get 1 bottle a month of the MSM, so you can take 6 a day, 3 at breakfast, 3 dinner time, or 2, 2, and 2. And they're going to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, including in the arteries and veins and so forth. And then because she has diabetes, I want her to get the sweeties, so she could take, I have her take 2 bottles of sweeties, so she could take 3 twice a day. If she's on medication for the diabetes, do not cold turkey off the medication. But as the blood sugar drops, she can slowly reduce the medication based on the numbers. Usually within 2 to 6 weeks, her diabetes will be gone. If she's a type 2 diabetic, which makes up 98% of the diabetics. Then the high blood pressure, I want her to get 2 bottles a month of our Ultimate Daily Classic tablets. Take 3 at breakfast, 3 at dinner time. Again, if she's on medication, don't cold turkey off of that. But as her blood pressure drops, she can slowly reduce the medication based on the numbers. Usually within 2 to 6 weeks, she won't have high blood pressure anymore. Well, how long do people have to stay on the diet, and how long do people have to stay on the nutrients? Well, forever. How long do you need oxygen? Forever. How long do you need water? Forever. How long do you need the essential nutrients? Forever. Okay. And then she can add 25 to 50 healthier years to her life, spend 25 to 50 more years with the people she loves, and spend 25 to 50 more years doing the things she loves to do. She's going to have a great story. This is very common history. And so we want her to call us every couple of weeks. It's toll free, so it doesn't cost her anything.
All right. Thank you so much, Dr. Wallach. And let's just move on. We have so many questions that are being texted and emailed in. So Tammy has a friend who has been diagnosed with spinal cell sarcoma. Spinal cell sarcoma.
Sarcoma, S-A-R?
Yes, S-A-R-C-O-M-A. She was in hospice 3 weeks ago, and they're very thankful that she is now home. But what would be causing a spinal cell sarcoma? And I know she was going to try to be on this morning, but I don't see her yet. Her friend is 54 years old, and she's down to 156 at 5'9". So she's about right where she's supposed to be.
Okay. Well, sarcoma is a soft tissue cancer. Okay. It could be in the brain, it could be in the heart, it could be in the kidneys, it could be in the liver. Sarcoma is a very general term for a soft cell cancer. Okay. So if she's got spinal, I'm assuming that's either disc or spinal cord or something. Okay. We don't know the details here. Is it her vertebrae and her back? We don't know this. Okay. But what we can do is support her immune system until we get more information. None of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rhinos, no sugar, no carbonated drinks. Even the diet one's got to go. And then at 156 pounds, I want her to have 2 of the Healthy Brain and Heart packs a month, the full dose of everything twice a day. I want her to get 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, bone matrix, including the bone marrow, is what her immune system is. Okay. And I also want her to have the BTT 2.0 tablets, which do not replace the BTT 2.0 powder, which is vitamins and minerals. The tablets will support her immune system and also support maintenance repair of connective tissue. So, and relieve pain and inflammation. So that's an add-on there. She could have 3 of those twice a day. So it'll be a big bottle. She could take 1 bottle a month of the BTT 2.0 tablets to pull that off. Okay. And then let's see here. Also for her immune system, I'd really like her to take some more take some more minerals, okay? Let's have her take some more minerals, and she can actually take either the oxybody or just the plain plant minerals. They come in either capsules or liquid. And the oxybody, get an added oxygen there, which cancer tends not to like, okay? And so I'd have her do that. We have a new stick out now. It's kind of the same size as this rebound stick, but it's a mix of, let's see here, of dried powdered plant minerals, okay? And a couple other things there, for glucogel and stuff like that. I'm very excited about that, okay?
And it has cherry extract, Dr. Wallach, so
And
it's amazing.
Cherry extract, well, there you go. Okay, and so, we can get her going here, and we need her to call and give us more information.
All right, thank you so much for that, Dr. Wallach. And Marie, Ruth Ellen is trying to help you get connected with your audio. So if you could look at the chat, if you turn the chat on, you may need to go out, come back in, and then we'll keep your place in line for you. So we want to make sure that we get Marie's information, or if she can even write it in the chat, that would be fabulous as well, and we can get it. So Dr. Wallach, Stacy's writing in on behalf of her friend Pavi. Pavi is 5'6", 210 pounds, 58 years old. In 97 and 2000, had back surgery to repair discs, has been on heavy painkillers. In 2022, the thyroid was removed, and because of a goiter, and is now on medication. In 2015, diagnosed with Crohn's disease. And because being overweight, looking at bypass surgery in 2 months. But here's the good thing. They've started just on the 90 essential nutrients, and she adds that in the first 3 days, she's already lost 8 pounds.
And don't do the bypass surgery.
No, I don't recommend the bypass surgery at all. But one of the other complaints is tiredness and peeing more and more often.
Okay, that's called polyuria. Okay. Yeah, I'd want to know how many times she's urinating at night. Is it once, 5 times, 10 times? Okay, that'll be interesting. Okay, well, here we go. 210 pounds. She's what, 5 foot?
5'6".
5'6", okay. Yeah, 5'6", I'd like for a girl to weigh maybe 140 pounds. So she's maybe 70 pounds overweight. She needs 1 meal a day to be our keto shake. It's a meal replacer. It's not to add to a meal, either strawberry or chocolate. And then I want her to get on 2 healthy brain and heart packs per month, a full dose of everything twice a day. She'll lose a half a pound or 2 pounds a day. Again, she needs 2 healthy brain and heart packs per month, a full dose of everything twice a day. I want her to get our MSM, 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at dinner time, and 3 at lunchtime. And that's going to help her support and promote maintenance repair of disc, back, the vertebrae and all that kind of stuff, peripheral neuropathy. That's going to help her with the polyuria. Also, because she has a history of thyroid issues, I do want her to get our, let's see here, Ocean's Gold. She could take 3 of those twice a day. It's 2 bottles a month. She could also take our Fucoid Z, take 3 of those twice a day. That's 2 bottles a month. They're from 2 different oceans, but they're seaweed and ocean minerals and so forth. Let's see here. Also, let's see here. She's got chronic, Crohn's disease. Yeah, that's a classic example of gluten issues. Okay, irritable bowel syndrome, Crohn's disease, celiac disease, all appendicitis, all that kind of stuff. So she really, 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 really needs to stay away from the gluten and just eat like an Asian rice and sweet potatoes and beans and squash and that kind of stuff. And then exhaustion. Okay, again, we're going for the rebound, either the sticks or the canister or the cans. Remember, if you're going to drink the cans, you need to pop the top in the morning and don't drink it until the earliest would be at noontime. Okay, because you want to make sure it's all exhausted, all the carbonation out of there, so you maximize absorption, and all her issues will go away, because everything she has is related to nutritional deficiencies, including that polyuria. Because what's happening here is what's going on in her spine is squeezing the sciatic nerve. She's got sciatica, which are squeezing the nerves going to the urinary bladder and causing her to urinate a lot. And the odds are she's getting up 2, 3, 4, 5, 8, 10 times a night to urinate. And that has nothing to do with the prostate gland, because girls don't have prostate glands. Okay, it's only a guy thing. And so she needs to know that this is being caused by her vertebrae and her skull squeezing the nerves to control the urinary bladder. We can rebuild that, and it wouldn't hurt for her again to get that book, It's All in Your Head. That book, again, covers 25 different diseases. There you go, 25 different diseases that are caused by osteoporosis of the skull. It'll blow your mind, because doctors are not trained in this. They have no earthly idea. Did you get osteoporosis of the skull? They, in their simple minds, believe you can only get osteoporosis in your bones and your legs, your vertebrae, and your hips and knees and that kind of stuff. Okay, but let's see, what is it? Let's see here, for osteoporosis, between the US, Canada, and the EU, we spend $6.5 trillion a year just to treat the symptoms of osteoporosis. That's their biggest dairy herd that they milk every day.
Well, Dr. Wallach, the skull is a bone. So let's think about it. If you've got some breakdown going on in one bone, how can it not be affecting other bones?
You get an A+, dear.
So, and you were just talking about, having to urinate very often. I don't have to go. I don't know about you, but we're at the top of the hour. Let's go ahead and take a little break, and everybody get up and stretch. Make sure that you have plenty of hydration. If you have our plant-derived minerals, throw a splash of plant-derived minerals in there, because it's only going to do the body good. So we will be right back with Ask Doc Live. Again, if you were invited to this program by somebody specific, whether you're on live or watching the replay, get back with them. Thank you, or send them a thank you, text however you're communicating with them, and say, thank you for sharing this information with me. It's the information that you are receiving here. We're providing this as a free service. A service that will help you find what you need in order to create that better health journey to go from surviving to thriving. Now, Dr. Wallach has spoken about his books many times, and the best place to get them, if you go to AskDocLive.com, you will see that we have a link for Doc Wallach's books. Click there. We have some of his most popular ones. And if the one you're looking for is not there, send us a message. As again, on Ask Doc Live, there's that contact us. Send us a message for the book that you're looking for. We'll make sure that you get the information you need in order to find that book. As Dr. Wallach has his own publishing warehouse also at drjwallach.com. We will be right back after this brief break. Hold on, folks. All right, and we are back with Ask Doc Live. This is a program being brought to you by AskDocLive.com. If you were not referred to this program by anybody specific, and you have nobody to thank, then feel free to go to our website, AskDocLive.com. On our website, we have a store that offers all of the products that Dr. Wallach is mentioning today. And if you don't know exactly what you need to take, use that contact us. Send us an email with what you have going on, and one of our certified holistic health coaches will get back with you and make sure that we choose a plan that best fits your personal needs and the nutrient deficiencies that you yourself are experiencing. We do have several certified holistic health coaches on our team that have been trained in what Dr. Wallach is sharing today based on his research, and also publications and research that's being published by other doctors supporting what Dr. Wallach is saying. There's many out there, folks. It's not just Dr. Wallach. People are finally waking up to the importance of, one, that good foods, bad foods list, staying away from those bad foods, because it does not match what the USDA food pyramid is telling us is a balanced diet. We're not looking for balance. We're looking for nutrition, folks, not something that's just going to be a filler to keep us full and keep us hungry. There's a difference. You can eat, and not be satisfied. But when you give the body the minerals and the vitamins that it actually needs, the hunger itself is suppressed because it's not starving. It's super simple. You don't need appetite suppressants when your body is not starving. Isn't that right, Dr. Wallach?
That is
That's
correct.
what I found.
You get an A+.
So and yes, we need calories. We use them for energy, but it's not those sugar calories. It's not those high carbohydrate calories. There's other ways to do it with nutrient dense foods and essential factors. I was getting there. Well, I think, oh no, I was hoping that Maria had her hand up and audio on, but let's go to the next question. And this one is coming in from Vincent, Dr. Wallach. So Vincent is writing in on behalf of his friend who is having arrhythmia. Okay, so arrhythmia has to do with the heart and heart beat, right?
Okay. Okay, anything else, or is that
He
just
said that it wakes him up in the middle of the night, and often his heart beating out of his chest for hours. At least that's the feeling that he feels. He goes to ER and they have to shock it back into a normal rhythm. The medication they are giving him is not working. And they're saying that he needs ablation. Now, I've heard you talk about ablation, and that's not always a very favorable outcome for.
What do you think? What do you think Vincent's friend has? What's his basic problem?
Well, we say it so often because so many things are related to osteoporosis of the skull.
You got it. You get an A+. And the reason why he's not responding to the treatment for arrhythmia in the heart, it's not a heart issue. So the heart's not responding because it's not a heart issue. You got osteoporosis of the skull, which is squeezing the 10th cranial nerve, the vagus nerve, which controls the rate and rhythm of the heart. When they're talking about an ablation, they're talking about anesthetizing him, cutting his chest open, taking his heart out, putting hot branding irons all over that heart, trying to find the part of the heart that's beating crazy. What's happening is the skull is squeezing that 10th cranial nerve, causing the heart to go into what's called AFib. And the fact that the heart is not responding to heart treatment, it just confirms that it's not a heart issue. Okay, it's the brain squeezing that nerve. And ablation is one of the most dangerous treatments that the medical system has. It kills, percentage-wise, more people than any other treatment. So he does not want to do that. And so basically, they need to call us so we can give him more information. But basically, he needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, rye, no sugar, no carbonated drinks. Either that one's got to go. He needs to take the Ultimate Daily Classic tablets, 3 of those twice a day to promote healthy blood flow and healthy blood pressure. He needs the MSM. Take 3 of those 3 times a day. That's 2 bottles a month. He needs to get 2 bottles a month of the, let's see here, the Healthy Brain and Heart Pack. Okay, 215 nutrients. And then he also needs a collagen and peptides. Take a scoop of that with his morning drink, scoop of that with the evening drink. He needs, let's see here. I would go with that. And then, give us a call every couple of weeks. Let us know what's going on here, because he should see some benefit if he's doing everything as we've said.
All right. Now, Dr. Wallach, I want to go back to your book. It's All in the Head.
Mm-hmm.
Okay. And in here, you've got a chart that lists all the nerves and then the common conditions that are associated with that, which since the publication of this, we've added a couple more, which I'm super excited about, because we talk about them in our CD that is
That we've done. Now, do we know when the CD? Yeah. Do we know when the CD is going to be released?
So soon. I'm hoping next week.
Okay.
So
very good. Yeah. And so, yeah, we did it. We see what it was. That book was published about a year ago. And so what we did, what Rebecca and I did, was we went through all the diseases that we've seen associated with osteoporosis of the skull in this last year, and which ones respond quickly and which ones respond completely and so forth. And so we have a lot of new information that when we reprint that book, when we get down to the point where we only have like 50 copies left, we're going to, reprint it again. We'll put another chapter in there with all the information that Rebecca and I have collected. But the CD will still be available because people can listen to it in their car while they're driving. They can listen to it while they're cooking dinner and all that kind of stuff. And hopefully they'll start sharing it in medical schools, so they'll save a lot of people's lives.
Well, that 30 minutes is so packed full of information, Dr. Wallach, that can save a lot of people from pain and suffering.
Yeah, and unnecessary death because incorrect understanding of what's happening. Okay, because they have arrhythmia or AFib, atrial fibrillation, or tachycardia, which is fast heart rate, or bradycardia, which is slow heart rate. All of those are caused by osteoporosis of the skull squeezing the 10th cranial nerve, the vagus nerve. And it's one of those things where doctors think it's a heart issue, but it's really osteoporosis of the skull.
That's right. Now, Dr. Wallach, let's look at disease in general. So when we're looking at disease in general, what are they doing? They're taking symptoms and then they're giving it a name.
Yeah,
right?
And of course, we looked at that at the beginning of the show, okay, of the Zoom. We looked at that with diabetes. We looked at that with arthritis. And, you have something like arthritis. We're spending $626.8 billion a year just to treat the symptoms of arthritis. Okay. In 1 year, that's 1 year, 626.8 billion just to treat arthritis symptoms for 1 year, not to prevent it, not to cure it. It's crazy.
That's super crazy, because when I look at myself and what I spent, because that was something that was one of my major issues. I mean, I was doing less than $300 a month, Doc.
Ooh.
And so you do that times 12, that saved me a lot of money, because my doctor visits,
almost $4,000 a year.
Well, my doctor visits, some of them just 1 hour, I was looking at almost $300 for 1 hour of seeing a specialist. And then if they did testing, I mean, MRI, the bill was $12,000.
Have you been back in touch? They've been back in touch with those doctors and said, "Hey, you want to learn something?"
Yeah. Well, that $12,000 told me when I was 30 years old that my bones and joints look like that of somebody 65, 70 years old in very poor health. Well, that explained why I was having so much pain and discomfort and why I felt really old. But now I feel fabulous.
What about these 16-year-old kids with juvenile arthritis? That you were one of them.
I was one of them. Yeah, it happens. And as we've mentioned before, if your child, your grandchild, a friend's child is experiencing pain, don't just chalk it up to growing pains, because chances are it goes much deeper than that. And it is simple to help them stop a progression of something that when they're 30 years old, they could have the bones and joints of somebody 65, 70 years old. It's not needed. Health is simple. Regaining health, depending on how far gone you are, is possible. It is possible to regain it. So I just can't say it enough, Doc. I am so thankful for you. I am so thankful for your research. I am so thankful for the formulations that you and your team have put together, because
Well,
they have given me back my life. They have given me a purpose and a reason to shout.
well, thank you so much for the kind words. And of course, the best payment you can give us is to share your good news with everybody else, so we can save all these kids and save all these middle-aged people and save all these seniors from unnecessary pain and misery and early death.
Well, and I'm doing that. I'm doing that.
Yay.
So I have my own radio program that I'm super excited about, Better by the Minute Health with Becca, that I enjoy every week. The guests that I have on there, where we're sharing better by the minute options that people can take and put into action for themselves as well. And Dr. Wallach, we've got some hands up that I want to get to, and let's go with James, as Maria is still working on her audio. James, go ahead and unmute yourself, my friend.
Hello, can you hear me okay?
Hear you great.
Okay, Doc, I had a
Now, is
an
this is
injury to
James?
my right
This-
arm.
Wait a minute, this is James, not Jane.
Correct, James.
James.
Okay. Okay, go ahead.
Yeah,
You
so I
have.
had an injury to my right arm. Pardon?
I said, go ahead.
And when it didn't get better, I mean, it got 90% better, but I finally went to a physical therapist recently, and he claims that my bicep, one of the upper tendons, isn't connected anymore. I have like a Popeye muscle, he called it. And according to him, there's no surgical repair for that. He said that wasn't very effective and they don't do that anymore. So I'm just wondering if there's anything nutritional I can do. The feeling he had was without an x-ray, that without that upper bicep tendon connected, the shoulder what ball wasn't staying centered in the socket. And when I did certain motions, it was moving out of the center and
Mhm.
perhaps causing
Okay.
the pain, but he wasn't sure. So his
Okay, so basically, how much do you weigh? Body weight.
200,
Okay, how tall are you?
200 pounds, 5'9",
How old are you?
68,
Okay, do you have any other issues? High blood pressure, diabetes?
nothing at all.
Okay, did you have your appendix out when you were a kid?
No,
Okay, irritable bowel syndrome, celiac disease, Crohn's disease, any of that kind of stuff?
no, I've been
Okay,
on the minerals since the 80s. I don't really have
Okay.
anything.
okay, good. Just that physical injury. Okay, now I
Yes.
deal a lot with professional athletes, Olympic athletes, university athletes, and military personnel by the thousands every year in 80 countries, okay, because of these kind of things. And so what I want you to do here is, again, you've done this, but for our listeners also, you need to get rid of all the bad foods, no fried foods. That's air frying, deep frying, pan frying, no processed meats, no oils, no glutens, no wheat, no barley, rye, no absolutely no sugar, no carbonated drinks. Even the diet ones got to go, because the diet ones still have carbonation. You don't want that, so you can absorb minerals and digest food. And then at 200 pounds, I want you to take 2 healthy brain and heart packs per month, a full dose of everything twice a day. I want you to get 2 bottles a month of our MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes bone itself, including the shoulder, okay, and the tendons and the bicep tendons and so forth. And then I also want you to get our collagen peptides. Take a scoop of that with your breakfast drink, and take a scoop of the collagen peptides with your dinner drink. I also want you to take the Beyond OsteoFX take a scoop of that twice a day or 3 times a day, whichever you want. I'd go with it 3 times a day to begin with here. It's a little scoops, and so you'll be able to do that with 1 bottle of the ultimate, let's see here. Beyond OsteoFX. Then I also would like you to take vitamin D3. Take 3 of those twice a day. There's 2 bottles a month, so you can absorb all this stuff and put it in the right places and so on. And then for inflammation and pain and all that kind of stuff, I want you to take the BTT 2.0 tablets. Take 3 of those 3 times a day. It'll be 2 bottles a month, or BTT 2.0 tablets. It will relieve pain and inflammation, okay, and will also help rebuild that tendon and the joint socket and all that kind of stuff, okay? And also it will support your immune system. So if there's anything going on in there that we don't know about, that'll help your own immune system kind of calm things down, quiet things down. Sometimes your worst enemy is your own self, because when there's something bad going on, your own immune system jumps on you, okay? So we'll see what goes on here. But do these things. And of course, if you have pain, rather than taking aspirin and that kind of stuff, I'd rather have you take our CM cream with maybe per teaspoon of CM cream, use the, from our aromatherapy oil division, use our trauma oil, put say 10 drops of the trauma oil in there and put that on your shoulder. And that'll give you a couple of hours of discomfort relief, pain relief. And so let's go there and then get back to us, say, in 2 weeks and 4 weeks and 6 weeks, and we'll walk you through this. But what you have is not uncommon in professional athletes and Olympic athletes and university athletes and the military personnel, because of all the trauma they go through in their day-to-day work and training and so forth, and during games and during battles and so on. I spent, let's just say I spent a lot of my life in the Army, in the Artillery Division, Fort Leonard Wood, 105s, 155s. So I know a lot about that. I spent 20 years in the Air Force, retired as Lieutenant Colonel in the Air Force. So I've seen just about every kind of injury you can think of, okay? And so I think you're going to benefit from what I just shared with you, because it's an accumulation of all those years of dealing with high trauma professions, whether it's the military or sports, okay?
Okay.
All
Well, thank you very
right.
much, Doc.
You bet. I look forward to hearing from you.
Thank you, James. Now, Dr. Wallach, looks like Marie is still not able to get her audio connected. And there we go. I have a question here in the chat. Monica is 5'6", 135 pounds, 67 years old. She says she wakes up with dry mouth and pees sometimes 4 times during the night. So of course that wakes her up during the night.
Okay. She has osteoporosis of the skull. Okay, dry mouth. Okay, which can be a manifestation of trigeminal neuralgia. It could be a manifestation of the 9th cranial nerve being squeezed, or is the 9th cranial nerve, of course, is a glossopharyngeal nerve, the throat and the tongue and all that kind of stuff. Okay, so between those 2 nerves being squeezed by the skull, when you have osteoporosis of the skull, okay, it's the 5th cranial nerve and the 9th cranial nerve can produce these symptoms, okay, of dry mouth and polyuria, because again, the skull is squeezing the spinal cord, and the nerves, the sciatic nerves, is being squeezed in her back, and so she got peripheral neuropathies, which are the nerves are squeezing the urinary bladder and causing her to get up and urinate 3, 4, 5 times a night. I get people who get up 10 times a night, every half hour, they're getting up to urinate. It's called polyuria. And, doctors just throw up their hands and say, we don't know what it is. You just, you just have to suffer with it, or wear diapers or whatever. And, or actually catheterize yourself, and you can just, let the pee go into a bucket on the side of the bed while you're sleeping, so you don't have to get up at night. But this is all very simple stuff. Okay, again, they don't know anything about osteoporosis of the skull. And so this is an educational thing where the patient will be ahead of the doctor here and knowledge. Okay.
All right. Thank you so much, Dr. Wallach. Now, the next question that is written in is coming from Helena. Helena says, I have in my family hyperparathyroidism. I was wondering, short of surgery, what can I do to get rid of it? I had an MRI done on it. They said that I have a very tiny, what is it, adenoma? Adenoma?
Adenoma means it's a benign little tumor, size of a pea usually.
Okay. See, folks, you do not have to know how to pronounce these words to do this business. Just saying.
Okay.
She
Okay.
continues with, my
Go ahead.
calcium level is 10.5 and my PTH has gone down to 50 after I started taking more vitamin D3. Do you have any products that you can recommend? And she says there is very little on the internet about it except for surgery.
Now she's 105, right? Pounds.
Let's go by 100 pounds. So she
Okay.
doesn't list her weight.
Okay, so we don't have to deal with the decimal points. Okay.
Right.
Okay. Well, the parathyroids, deal with a lot of things, including the calcium stuff. And before we, I can give her a basic program, but I want her to get the book, Rare Earths Forbidden Cures. Go to chapter 10, so she can get a hair analysis. And it tells you in chapter 10 how to collect the hair, how to package it, where to ship it. Don't forget to put the check in there because the lab won't run the test without the check. And it gives you two bits of information. One is, do you have any toxic metals like lead and mercury and uranium and other toxic metals? Also, it goes into all the nutritional minerals. Are you absorbing them? Are you good with 90% of them and have 10% that are low? Or you have only one that's low? Or one of my favorites, of course, is the calcium's off the stick. The calcium is just off the roof. The doctor says, oh my God, you're taking too much calcium. You need to stop taking calcium. What's happening here is the parathyroid glands are pulling calcium out of the bones because you have a calcium deficiency and they're overreacting. And so the calcium in your hair analysis goes up, okay, because the parathyroid is being overactive. So what you need to do is, okay, we got it. It's all in your, rare earths forbidden cures. Okay. And so the parathyroids, actually work on mineral levels and so forth. And so what I need Helena to do is get rid of all the bad foods. You've heard this before: no fried foods, no processed meats, no oils, no gluten, no wheat, rye, oats, no sugar, no carbonated drinks. Even the diet one's got to go. And then she needs to take 2 healthy brain and heart packs per month, a full dose of everything twice a day, because she's got these pathologies. So she's only 100 pounds, but she's got this pathology. So she needs to hit it hard. 2 healthy brain and heart packs per month. That's a full dose of everything twice a day. She needs 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, or dinner time. They're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between her vertebrae, bone, makes the bone itself. And then let's see here. She also needs to take the collagen peptides, take a scoop of that with her morning drink, a scoop of that with her evening drink. She needs to take a scoop twice a day of the Beyond Osteoporosis. She needs to take the vitamin D3, 3 of those twice a day, so she can absorb the minerals and put them in the right places. And then what I want her to do is also get her Ocean's Gold. She can take the Ocean's Gold. She can take 3 of those twice a day. That's 2 bottles a month. And I would go there. Let's just go there. That's going to kind of give her what she needs. And of course, she'll pay the wholesale prices for things. If she gets on auto ship, I will pay the shipping. And so this is something that's going to make a very quick benefit for her. Okay.
All right. Thank you so much, Dr. Wallach. And Yvonne is on with us tonight, and she says, morning from California. Doc, can you help me explain to a few who are concerned with this why malt dextrose and the fructose is in some of the core products? I have a lady with stage 4 kidney concerns, but she doesn't want to take this goodness to help her because of the fructose.
Okay. Well, let's see here. What I would say is have fun. Okay, because there's no medication that's going to help you if you have problems going on with your, did you say her thyroid gland?
She's got stage 4 kidney concerns.
Oh, kidney. Okay, kidney. I'm sorry. Okay, so do we know how much she weighs?
We do not, but Yvonne, if you can unmute yourself, if you have that information, that would be fabulous.
Yeah, are they talking about kidney dialysis?
Good
Does she have-
morning, Doc.
Hi, do you have,
Hi,
are you on dialysis?
She is not on dialysis yet. In 2 weeks, she's expected to have a kidney transplant. She weighs 100 pounds and is 5'4".
Okay, the ultimate question she needs to ask the doctor is, does he have a kid in college and his tuition due?
He probably does.
Okay, so yeah, this is a case that they died, but she's not on kidney dialysis. She's just going to go straight to kidney transplant.
She was traveling, Doc. I think she lost signal,
Okay,
but that's what it
so-
sounds like.
yeah. Okay, well, at any rate, what we need to do here, this lady needs to get off all the bad foods, get on the Ultimate Daily Classic tablets, needs to be on the Ultimate Daily Classic tablets 3 twice a day minimum, depending on her body weight, to support healthy blood pressure and healthy blood flow through the arteries everywhere in the body, including the brain and the heart and the kidneys. And we take people that haven't urinated. We take people that have not urinated in 10 years, are on dialysis 6 days a week for 10 years, are on dialysis for 20 years before that, 3 days a week, because they didn't want to get a kidney transplant. And we got them going on our program, which I just gave you for her. And within 2 weeks' time, they're urinating after 10 years of not urinating. So they dropped the dialysis down to 3 days a week. And in 2 more weeks, they're totally off of dialysis and back to normal after 25 years of being on dialysis. Okay. And so this is not difficult. Okay. And if she'd rather have a kidney transplant, okay, then take a product that's going to save her kidneys and save her body and save her heart and save her brain and add 25 to 50 years of her life, because it has some form of carbohydrate in it. Okay, then what can I say? She's made the decision.
So Dr. Wallach, there's one thing that I do want you to say, because I know that you have done several autopsies that concerned kidneys. What did you find when you were looking at those kidneys? I remember you mentioning they looked perfectly healthy.
Yeah, well, again, and I don't know which ones you're talking about, because I've done thousands, so you have to give me a little more information so I can be more succinct. But basically, I don't know if you're talking about kidney stones. I don't know if you're talking about kidneys that are, they want to put them on dialysis, and the patient doesn't want dialysis, so they're going to go for kidney transplant and all that kind of stuff. Kidneys
I remember you mentioning that it turned out that there were blockages. The kidneys were still good. They just had blockages that were keeping them from functioning properly.
Okay, well, they could have blockages like a kidney stone, okay, which is caused by a deficiency of calcium, not too much calcium. The doctor's always, oh, you got too much calcium, you got kidney stones. No, there's not enough calcium. And so again, your parathyroid glands are kicking out more calcium from the bones to raise the calcium levels in the blood, and causes the kidney stones to build up in the kidneys and so on. And so really, you don't need to have a kidney transplant, okay, when you have those situations. What you want to do is get off all the bad foods, get on the Healthy Brain and Heart Pack, get on the MSM, get on the collagen peptides, get on the Ultimate Daily Classic tablets, get the blood flowing through the blocked arteries, and help support healthy blood pressure, and take vitamin D3, 3 of those twice a day per 100 pounds of body weight to absorb the minerals and put them in the right place. And so this is not difficult. You just remember that insurance will pay for all these surgeries and all this, that, and the other, but it's going to, perhaps you could die on the surgery table. That's a possibility. Okay. You could have major things going on that impact you negatively for the rest of your life. Okay. And so why don't you try something less invasive first before you go that direction? But, you know, everybody makes their choices.
Right. So kidney failure is still caused by nutrient deficiencies.
That's correct.
All right. Thank you so much, Dr. Wallach. And it looks like Marie's audio is still not connected.
Let's keep going forward.
We'll keep moving forward. So Monica would like to know if you've ever had a colonoscopy, and is it a necessary evil?
Personally, I've never had a colonoscopy. I'm not going to let some doctor stick a tube up my butt. That's not going to happen. Okay. You can get information from a scan. Doesn't need that. Okay. If you want to find out if you have parasites, take your bowel movement, give it to your veterinarian, say it's your dog's bowel movement, and find out if you have parasites. Costs you $10. Okay. And so forth. And you can get all the information you need that a doctor would get from a colonoscopy by doing a scan, you know, a non-radiation scan. Okay. And so I'd go that direction as opposed to letting them stick some device up your tubing in the butt. Okay. And that's kind of the direction I would go.
I'm going to stick with your direction, Dr. Wallach, personally. So Ruth Ellen is going to ask Marie's question for her. Ruth Ellen, go ahead and unmute yourself.
Marie, what is your question? What is your question?
Do you have her on
Yeah.
the line?
I have her on the line.
Okay.
Sphenoid sinus. Okay, let's start with your height and your weight. And 4'11", 70. How? What do you weigh? 75 pounds.
It's better than 475. 75 pounds? Is this an adult woman?
Hold on just a second. I'm gonna.
Okay, I'm still not
Just let me-
getting this.
Yeah, I
I'm
know.
hearing
I know.
mumbling.
Bear with me, Dr. Wallach.
Ruth
Okay.
Ellen, while you get some information from her, then
Well, I was gonna go ahead and speak, Marie.
MRI results say that sphenoid sinus and say that I need to get operation. But it didn't go through my brain. But they say recommended I do surgery to clean out the bacterial infection.
Well, let's go back to the beginning. How
Also, the
much does
MRI
she
results-
weigh?
How much do you weigh, Marie? How much do you weigh?
75 pounds.
75 pounds. She's 4'11". She's 75 pounds.
How old is she?
How old are you, Marie?
77. Does she have any
77.
high blood pressure or diabetes?
Can you hear the? Can you hear Dr. Can you hear Dr. Wallach?
I'll tell you what. Why don't
I'll
you
get
collect
the
that information? We'll talk to her
I
next
just
week.
thought it would work. I'm sorry, Dr. Wallach. I'll get everything I need from her, and then
Okay.
I'll call you later.
Thank you.
all
Okay.
right. Thank you for trying, Ruth Ellen. Dr. Wallach, next. Usa is writing in regards to delirium, seizures, caused by the body swelling. Currently 24/7 on an IV, toxic with multiple drug combinations. Not able to sleep, not able to eat, and is not
How old
able
is
to
she?
get anything by food.
What is she? How old is she? What does she weigh?
So 87 years old, down to 125 pounds, at 5'7", And this is a man, Dr. Wallach.
And his name is Melissa.
No, it's USA writing in for a gentleman.
Okay. Okay. So he's on 24 IVs, seizures, delirium. He's 87 years old. Okay. And so at 87, the odds are this guy has osteoporosis of the skull. Okay. And so is he at home? Is he in a facility? I mean, where's he at? Do we know?
Well, since he's on an IV 24/7, I would say probably some type of facility.
Yeah. Okay. So this is kind of difficult. Okay. Because they're not going to do what we say. But basically, this guy could have osteoporosis of the skull, squeezing the spinal cord. And so everything south of the skull and the spinal cord and all the nerves going to the arms and the heart and the lungs, and they have COPD, they have hiccups, they have atrial fibrillation, and they have seizures. He could have MS, could have multiple sclerosis. Of course, that's the basis of our new CD coming out. It's all in your head, because when people get MS, multiple sclerosis, they get osteoporosis of the skull, many of the symptoms are kind of overlapping, and it confuses the doctors, and they just call, oh, MS. Okay. Could, make the doctor happy with a diagnosis of MS. You have to appreciate that this could be just due to a cholesterol deficiency. Okay. It could be due to multiple nutritional deficiencies of all kinds. So we got a mess here. And so this person, at the very least, they need to have some family member go there and every day rub a half a teacup twice a day on the chest and the belly, okay, of our liquid plant minerals, and then a half a cup twice a day on the back between the shoulder blades and the low back. We've taken people in comas in hospitals, and Johns Hopkins, they called the family and said, look, this guy's been in a coma for 6 months. He's only got a couple of days to live. If you want to talk to him, he can't talk to you, but if you want to talk to him and let him know you love him and all that kind of stuff, you better come in now, because he's only got less than 2 days to live. So we had him do that, just rub the minerals on the chest and the belly and the back, upper and lower back. In 3 days' time, this guy wakes up, shaves, goes back to work. Oh, he was a pastor, Mike Freeman. And he went right away to his TV studio and his radio studio in the church and starts telling the world his experience. So I fly out there, we do an interview. We made a CD and a DVD set called Praise the Lord and Pass the 90. Okay, now that was 10 years ago. And he's still going strong. And Johns Hopkins, they're still sitting there with their mouth open. Okay, because they had no earthly idea what to do for him. And they're just going to let him die because they didn't know what to do for him. And so just rubbing the minerals on him, he absorbed the minerals through his skin, went through his bloodstream to his brain and his heart and his liver and all that other stuff, because he didn't have a G tube, so he couldn't give him anything through a G tube. So he just rubbed the liquid minerals on him. And I do this a lot with people who are in comas. And it works every time. Okay, they absorb these minerals through the skin. And so, and of course, that's why, again, we have the CD and the DVD called Praise the Lord and Pass the 90. If you've ever been in the military, you know where I got the title to that CD DVD set. When you're in battle and the enemy's shooting at you, you want two things. Number one, you want God on your side. And the other one, you want plenty of ammunition so you can shoot back. So praise the Lord, thank you, Lord, and pass the 90. No, pass the ammunition when you're in battle. When you have a health issue, it's praise the Lord and pass the 90. So that's where I got that from, because of all the years I spent in the military, retired as lieutenant colonel in the Air Force. So I use the military lingo to edify the things we can do so simply, just rubbing these liquid minerals on the skin. They absorb through the skin and heal all these things that the doctors couldn't fix with all their prescription drugs and all their surgery and all their facilities and this, that, and the other. And just, for a few bucks a day, I mean, we're talking very, very economical stuff here. Okay. And so that's what I would do.
Well, Dr. Wallach, Rhonda just put in the chat, she wants to know, would minerals topically help broken bones in the area to heal better?
Well, they will certainly support the healing, increase the rate of healing. Okay. But you need, I'd go for more. I'd do the healthy brain and heart pack. I would do the MSM. I would do the collagen peptides. I would do the Beyond OsteoFX, and I would do also the plant minerals on the outside, just on the skin. Okay, but the minerals are the minerals, and you need a bigger picture. Okay, if they can take things orally, to take the oral stuff, and then use, no reason why you can't do that. You can't do both. I have people that do both. Okay, they do the oral stuff and they do the minerals on the skin. Okay, and that way they're getting the best of both worlds.
All right, thank you so much, Dr. Wallach. Corey is writing in on behalf of his 30-year-old daughter. Brief history: she was adopted at 2 weeks old, so he has limited family history, which, Dr. Wallach, that doesn't make much difference, does it?
Nope.
Because there
There's
are
no genetic diseases, no
diseases.
autoimmune diseases.
Yes. So at 3 months old, she was hospitalized with sepsis due to urinary reflux, treated for 2 years with a prophylactic antibiotic before it corrected itself. 15, she was unofficially diagnosed with Asperger's syndrome and officially diagnosed just last year at the age of 29. At 9, menstruation started, breasts began to show, average height and weight from infancy through 13. And then at 14, she was 10 to 15 overweight. At 20, she was 40 to 50 pounds overweight with a cup size of EF on her bras. But now let's go ahead and skip through. Now she's over 50 pounds overweight, Dr. Wallach. And even though she's only doing 1,200 to 1,500 calories per day, she's only lost a couple pounds. Now, I know when I really cut back on food, it did not make a difference because my body was still starving. So it was holding on to everything that it got.
Okay, well, you have to appreciate that when people are overweight, it's because they're nutritionally deficient, not calorie deficient, but nutritionally deficient. So they develop a behavior called pica, which means you're going to eat and eat and eat. I don't know why I'm eating. I've had 10 meals today. Each meal is big enough for a 700-pound person. Why am I eating? I've eaten so much already today. I'm still hungry. Well, that's because they're eating gluten, wheat, brown, rye, and oats. They cannot absorb nutrition, and they're starving. And so their body's telling them, you better get that food in you, looking for those nutrients. And so they eat and they eat and they eat, and that's why they gain so much weight. Okay, and doctors haven't figured that out yet. They get that behavior because they are missing nutrients, and they develop that behavior called pica, P-I-C-A. And so here's where it needs to be on the, let's see here, it needs to be on the keto shake, a meal replacer, 1 meal a day. Doesn't have to be the same meal every day. On the weekends, either Saturday or Sunday, 1 day on the weekend, do 2 meals a day of the keto shake, either strawberry or chocolate. And then you can start out by taking 2 of the Healthy Brain and Heart Packs per month, full dose of everything twice a day. MSM, 2 bottles a month, okay there. Full dose of everything at breakfast, lunch, and dinner. Collagen peptides, collagen peptides, a scoop of that with the morning drink, scoop of that with the evening drink. And then again, the collagen peptides, I can't speak enough about them. It's going to help with the immune system and so forth. And so that's kind of the direction I would go.
All right. Thank you so much, Dr. Wallach. Now, we're looking at somebody that has Asperger's or some type of behavioral mental condition. What would you add to help support brain function?
Okay, it wouldn't hurt to take 3 eggs twice a day with soft yolks. Get the cholesterol going in there, so it's not really MS or Asperger's or Parkinson's disease. They're all kind of related. Alzheimer's disease, okay, they're all related. They're all cholesterol deficiency. So 3 eggs twice a day with soft yolks. Fried eggs won't count. Hard-boiled eggs won't count. They got to be soft, scrambled, soft in butter, soft boiled, soft yolk, soft poached, soft yolk, soft scrambled in butter. And that's going to help. Okay. It doesn't hurt to throw in Synaptive. I got 5,000 products. You can take Synaptive, which is the raw materials for the brain to make chemicals to talk to its neighboring cells. Okay. I take 3 of the Synaptive twice a day. I have to pay for everything. I don't get it for free. So I pay for everything. So when I'm telling people to do things, I know how much it costs because I have to pay for it. Okay. And
Well, it's an investment into you.
yeah, it's an investment
Your
into you
family.
and your family and how long you can live and how long you can spend with the people you love and the things you love to do. If you're prepared to give up 25 to 50 years because you don't want to spend, say $200 a month on yourself, then hey, that's everybody's choice. But if you're willing to spend a couple $100 on yourself every month, you can add 25 to 50 healthy years to your life. We don't do very well when you look at the life expectancy. The life expectancy of Americans is 75. The Japanese is 84.7. And it's one of those things where, they live 10 years longer than us, the Japanese. Why is that? That's because they eat like an Asian. They're eating rice and sweet potatoes and beans. They eat a lot of seaweed. That's why we have the Z radical and the fucoid Z and the ocean's gold to get those minerals from the sea. Okay. And, but that's why the Japanese live 10 years longer than us. Now, when you look at people, we're talking 75, that's our average lifespan. When you look at the people who live a long time in the United States, we're talking 110, 115, 118 is the longest documented human being in modern times, 118. In the Bible, in the Old Testament, they're talking 120, 200, 300. Let's see here. Then you have people like Methuselah who lived to be 969. Is that true? Well, if you believe in the Bible, it's true. Okay. 969, it's almost 1,000 years old. And so somewhere between 75 and 1,000, we should be able to do better than 75 since our doctors stand on top of the hospitals, take their shirts off and beat their chests like Tarzan and say, we have the best healthcare system in the world. Okay. Well, that's not what James Hilton said when he wrote the book. Let's see here.
Lost Horizon.
Lost Horizon. And a new movie came out, Lost Horizon. Okay. And James Hilton was an investigative reporter for the New York Times. And he was sent to Hunza and to chase Dr. Lee, who is a Chinese doctor running around saying he could help people live beyond 100. And so he wrote the book on what he saw there in 2 years' time. It's all, the Lost Horizon, the book. And it was so popular, they made a movie out of it in 1936, I believe it was, black and white English movie. And then some years later, 1976, came out with the color version, was kind of a musical thing, for a Hollywood version of it, Lost Horizon. So I've watched them both, thanks to your help, Rebecca. I was able to watch both of those movies. A long time ago, I did read the book. And the place where all these people lived a long time was called Shangri-La. And that's where the hippie generation came from, was the book Lost Horizon, in that early movie, 1936 version, Lost Horizon, and Shangri-La. Everybody knows about Shangri-La. Well, that's all related to that investigative reporting that James Hilton did from New York Times.
All right, Dr. Wallach. Well, we have a little more time here, and I have another question through email. And this is coming from CJ. CJ says, my dad is 78 years old, has a UTI with white blood cells. What would you recommend? So let's see, CJ's dad is 200 pounds, Dr. Wallach, at 78. What would you recommend for urinary tract infections with white blood cells?
Okay, does he really have a UTI, or does he have osteoporosis of the skull, squeezing the spinal cord, which is causing him to urinate every hour at night and waking up 8 to 10 times a night? And the doctors, and they tested him, he doesn't have a prostate problem. So they said, oh, you have a UTI. Okay, and so that's what I think is happening here. Okay, men really don't get UTIs like women do. Okay, so they say UTI, that tells me that he's urinating, getting up 5, 6, 8, 10 times a night to urinate, and they tested his prostate, and that's negative for cancer. So they say, okay, you got a UTI. So at 200 pounds, he needs to get rid of all the bad foods: no fried foods, no processed meats, no oils, no gluten, no wheat, rye, no soy, sugar, no carbonated drinks. You've heard that 100 times before. Then 2 healthy brain and heart packs a month, a full dose of everything twice a day. He needs to take 2 bottles a month of the MSM, so he can take 3 at breakfast, 3 at lunch, or dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone, makes bone itself. And he needs to get a hold of that book and soon the CD, but certainly right now the book, it's all in your head. And so the skull can be squeezing the spinal cord, causing all kinds of stuff going on south, including urinating multiple times, polyuria during the day and at night. And they're blaming it on an infection because then they can write a prescription. And again, they got kids in college and they need the tuition money and blah, blah, blah. You know the drill. And so, but again, here's where he needs to be taking the collagen peptides, a scoop of that with his morning drink, scoop of his evening drink, a scoop twice a day of the Beyond OsteoFX. He needs the, see here, I would also throw in the Ultimate Daily Classic tablets, 3 of those twice a day to support healthy blood pressure, but also to help support healthy blood flow through blocked arteries, including in the kidneys. Make sure the kidneys are working properly. And let's see here. Let's go there.
So Dr. Wallach, what would cause an elevated white blood cell count?
Well, if you're peeing 10 times a day, just the inflammation, okay, of urine running through there that many times a day, you're going to get some white blood cells in there. Your body doesn't like things that are out of scale. Okay, you're supposed to urinate 2, 3 times a day, not 10 times a night. Okay, and so when you get that inflammation, it doesn't have to be an infection. Just irritation will cause white blood cells to go there saying, what's going on here? I'm getting a signal, there's something bad going on here. And so the body sends in white blood cells just in case. Okay.
All right. Thank you so much for that, Dr. Wallach. Greatly appreciate the information. And I know that there are so many others that also appreciate the information that we are sharing here today. For myself, I love that Z radical, and I put a splash, another ounce of plant-derived minerals in there. So I'm getting minerals from the sea. I'm getting minerals from our prehistoric mineral deposits that are found in Utah, and making sure that I keep my body just flowing with minerals, because minerals, folks, are the currency of life. Without minerals, as you are hearing on this show, you're opening up your body to so many different diseases that are caused by mineral and nutrient deficiencies. Right, Dr. Wallach?
That's correct. And of course,
So-
if they think he's got a urinary tract infection, did they culture his urine and get bugs? No. If they did culture his urine and didn't get bugs, they're still calling it a UTI because they don't know what else to say.
So there's a lot of things that we can do that mainstream medical has not been trained on. We're not saying that they're all bad doctors. We're not saying that at all.
But they're
This is
ignorant
what-
of a lot of stuff.
They've not been trained. They've not been exposed to what Dr. Wallach, who has a postdoctorate in pathology, has seen in thousands and thousands of autopsies.
Yeah, and my thesis is in the Smithsonian Institute as a national treasure because I showed these things. I've documented these things. They're unimpeachable information. That's why my thesis is in the Smithsonian Institute as a national treasure. I'm very proud of that.
Yeah, that's very cool. And as you mentioned earlier today, you have taken and condensed that information into the book Epigenetics that we can get our hands on for our very own. So yeah, Epigenetics, I got my own copy right here. I love it. I use it. Always looking for information that helps to support people's journey in finding what they need to have a stronger and thriving life. Because it is possible, isn't it, Dr. Wallach?
Absolutely. You can add 25 to 50 health years of your life just by avoiding the bad stuff and taking the nutrients. Now, again, I like the BTT 2.0 tablets for the immune system, but it's not a replacer for the BTT 2.0 powder, which is vitamins and minerals. And that's why I like the Healthy Brain and Heart Pack. It has 215 nutrients and includes the 90 essential ones that everybody agrees upon. We've added 115 nutrients to it, okay, that haven't been universally acclaimed to be essential, but they're nutrients that do good things in your body. And so you might be able to live without them for a while, but you're going to start getting symptoms. So I still count them as essential. If you get symptoms and something's missing, they're essential.
That's absolutely right. And folks, where there are some vitamins that our body can create on its own, we cannot create minerals. If the minerals are not in our food sources, we're not getting them. If our food sources are grown in dirt that doesn't have the minerals in the ground that food is grown in, the food doesn't have it. So we're
That's right.
still not getting them.
Yeah, well, see, minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. Now, back when we had wood stoves, we were getting minerals from our wood ashes. Grandma would put the wood ashes from the stove into our food in our gardens. Once we went to electricity, all our sources of minerals went away, which we've been using for thousands and thousands and thousands of years.
Yep, that stopped. And that was going to be my next step, Doc. So you beat me to it. I've been listening, and I know many others have been listening as well. We are at the top of the hour. Folks, you have been listening to Ask Doc Live, sponsored by AskDocLive.com. If you were invited to watch this program by somebody specific, and yes, please, co-hosts, come on, spotlight with me. Get back with the person that invited you to listen to this program. Send them a thank you and give them a call. Say thank you for sharing this information with me, because I know each of us knows somebody, if we ourselves are not affected by something that was mentioned on this program today. We are empowered individuals. We can take steps without a prescription to choose a better, more complete, thriving, not just surviving, health journey for ourselves. If you were not referred by anybody specific and you would like to speak with somebody on the phone and get the products on the way to you so you can get started and give us 90 days, we do have a call team that is standing by at 855-949-7234. If you prefer to work through email, go to AskDocLive.com and use that contact us. On behalf of myself and the Ask Doc Live crew, Dr. Judy, Heather Bowen, Nasima Omar, Ruth Ellen Sanchez, and our special amazing guest, Dr. Joel Wallach. Bye for now.
Bye.
Bye-bye.
And we'll see you
Bye-bye.
next week. Invite a friend. We love having new people come on, hear the information, and since you've heard it once, you have the duty to share that information, folks. See you later.
Bye-bye.